Thousands of studies have looked at the mind-body connection, but today I'm going to introduce you to a new and radically different understanding of considerable importance. And it's relevant to many conditions, as you can see, and others as well. But I'm going to focus on hypertension because there have been more mind-body studies in hypertension than in any other condition. Hypertension is the most commonly diagnosed medical condition, and also I specialize in hypertension, and therefore I have the most experience with it. So why do we need a new mind-body understanding? Thousands of studies have focused on the effect of stress, emotional distress, anger, anxiety, and blood pressure. And after decades of those studies, what do we come up with? Basically nothing. Meta-analyses of well-conducted studies, and this was one of them, which analyzed 300 highly quality studies, and they just came up with nothing. These emotions do not cause hypertension, and relaxation techniques don't do much for them. In a study that we did, we looked at 3 types of patients: normal blood pressure, mild hypertension, and very severe hypertension, and we administered anger and anxiety questionnaires. And as you can see, there's almost no trend, no difference between any of these groups. What about treatment, relaxation techniques, biofeedback? Again, there are many studies, meta-analyses find little benefit of them. Transcendental meditation also. Recent review of 18 studies, minimal effect on blood pressure, and even that effect waned after a few months. So after all those decades of studies, where does that leave us? It leaves us nowhere. Is there a mind-body connection? Yes, there is. But let's look at hypertension and figure out where it lies. Now, what causes hypertension? There are 3 mechanisms that are responsible for hypertension in almost all patients. And in any individual, there may be 1 or 2 or 3 of these mechanisms that are operative. 2 of them relate to the kidney function. And studies tell us that when we treat patients with a combination of drugs to tackle these 2 kidney mechanisms, patients achieve a normal blood pressure 80%. So in 80%, hypertension is related to the kidneys. It is not a mind-body disorder. Where the mind-body connection may lie is in the neurogenic, sympathetic nervous system. Our fight or flight reflex, in response to stress, it secretes adrenaline, increases our blood pressure and heart rate. And that is the 3rd mechanism, and we consider it particularly in patients who don't respond to the usual medications. And here the treatment is a combination of beta blocker and alpha blocker targeting the sympathetic nervous system. So what is the cause of increased sympathetic tone? Medical researchers have studied this for decades. There are many theories, but in fact, they still don't know. What about emotion? Well, we just said emotions that we experience have nothing to do with hypertension. Then we need a new understanding. And the patients who I learned from first were patients with an uncommon form of hypertension called paroxysmal hypertension. They experience sudden, severe episodes of severe blood pressure elevation with headache and other symptoms. It occurs out of nowhere and not at times of stress. Can last for hours, many ER visits, and they get recurrent episodes every few days or weeks, and this goes on for years and really affects their lives. And after years of research, nobody knew the cause, nobody knew how to prevent recurrent episodes. One thing that was known, sympathetic nervous system tone is increased during attacks. And the question, though, is why? What was going on here? In one of my first papers on this, I noticed 2 things that were very conspicuous that nobody had noticed. These patients, in the absence of much current stress, one after another reported a past history of severe or prolonged stress or trauma. The other thing is they all insisted it did not affect them emotionally. This was too much to be coincidence. And when we talk about repression, there are two terms that many use interchangeably, but they are totally different from each other: suppression and repression. Suppression is a conscious mechanism. We try to focus on other things. We may be very upset or grieving, and instead of spending all our time on that, we focus on work and on other things to avoid those emotions. And it's important to our emotional resilience. Repression is totally different because it's an unconscious process. We don't know that we're avoiding the emotions, and they simply disappear from our awareness. It is a gift of evolution that enables us to do that without any effort. The emotions are gone. It enables us to survive emotionally despite horrific stress at times in our lives. And we need that protective repression. It's a gift, but few realize that those emotions persist within us. We would swear that they don't, but they do persist. They stimulate the sympathetic nervous system and other systems, and they contribute to medical illness over time. Now, I did not know if it was safe or dangerous to pursue getting in touch with such horrific emotions. Patients taught me that emotional healing is possible upon gaining awareness of long repressed emotions. But there are also barriers. The unconscious barrier is a strong one. Also, we're unlikely to gain awareness if our current life is not in order, or if the past trauma was particularly severe, and we need that protective repression. It's a minority of patients that do get this healing, but it's an exception that proves the rule, and it heals in hypertension, and I've seen it as well in other medical conditions. And in a subsequent publication, we find that 90% of patients with this disorder given an antidepressant respond with a cessation of attacks. And to this day, there is no other pharmacologic treatment that helps anybody with this disorder. This is the only pharmacologic treatment that works. Another investigator also found a 90% response rate. There is no other pharmacologic treatment. The main problem in looking at other forms of hypertension, there's a paucity of research. Nobody has ever considered the role of repressed emotions or looked at that, and we can't measure them like we can measure the emotions we experience. That said, there is research evidence, ironically by researchers who have no idea about repression, but they looked at factors such as a history of trauma and evidence of increased sympathetic tone in a number of conditions: hypertension, chronic fatigue syndrome, inflammatory bowel disease, and other conditions. This was a study that we did, and we gave patients a childhood trauma questionnaire. We treated them with each of 2 drugs that target the 2 kidney mechanisms. And overall, 59% achieved a normal blood pressure when treated with one or the other of those 2 drugs. Now, those with a history of no childhood trauma, 79% responded. This is kidney-related hypertension. This is not mind-body. Of those who did have a history of trauma, only 25% responded to drugs that target the kidneys. This is where the sympathetic nervous system comes in, because it has to be a different mechanism. Hypertension in young adults. Hypertension is more common as we get older. When we see a young adult with hypertension, we look for a cause. We usually don't find one. And what does research tell us? Studies have looked at the ACEs questionnaire, adverse childhood events, and as you can see, the list of those events, and they're not uncommon. A majority of adults, and many have 3 or more history events. In this study, looking at the number of adverse events reported going from none to 3, hypertension that began at any age, no relationship. The probability was basically close to 1. Those whose hypertension started before the age of 40, that doubled the risk of developing hypertension, those who had that kind of history. Another study assessed the adverse childhood events and then followed blood pressure into their 30s, and it finds that the more events they had in childhood, the more their blood pressure was likely to increase at that young age in their 30s. Severe or resistant hypertension, here also we look for a cause, but we cannot find one. Studies indicate a greater likelihood of increased sympathetic tone, both in patients with more severe hypertension and also in patients with resistant hypertension. And interestingly, current treatment guidelines for resistant hypertension do not even mention the use of combining an alpha and beta blocker as the best medication for their hypertension. So to summarize on hypertension, in most patients, hypertension is not a mind-body disorder. Where it is, it's probably related to sympathetic nervous system tone, which is otherwise unexplained. And nobody suspects the role of repressed emotions, and we need to focus on that. And more importantly, 3 treatment options. 1, use of medications to target the sympathetic nervous system, beta and alpha blocker. 2, in patients with paroxysmal hypertension, antidepressant, even though they're not depressed or anxious. It's the only effective treatment to this day. And finally, the opportunity for emotional healing. And I emphasize to patients, repression is not psychopathology. It was a gift that is crucial to emotional resilience. And yet, popular books on emotional resilience don't even mention repression. Finally, other conditions, these and others, we don't fully understand their cause. We don't have the best treatment. Briefly to comment about a couple of them. Chronic fatigue syndrome. It affects millions. And to this day, we do not know the cause, and we don't have effective treatment for them, and they suffer for years. Studies tell us that patients with chronic fatigue syndrome, almost every study shows increased sympathetic nervous system tone. Studies also show that there's double or triple the history of adverse childhood events in these patients. And in my experience with patients with chronic fatigue, almost everyone has that story of a history of severe or prolonged stress or trauma and the absence of any emotional impact. Migraine, also associated with a greater likelihood in patients who have adverse childhood events. And in those with migraine who have such a history, the headaches are more frequent and there's a younger age of onset. We need to introduce this into the research that we do because it's been completely missing. So to conclude, repression is a gift of evolution that is necessary for the emotional survival of so many of us. It is a gift, but there's also a cost because those emotions, unfelt, persist within us and affect the sympathetic nervous system and other systems. It is relevant because it helps guide us in treatment, whether blood pressure medication, consideration of antidepressants in somebody who's not doing well but is not depressed or anxious, and the opportunity for emotional healing by gaining awareness of long repressed emotions. The key problem is the paucity of research. We need to begin to study the role of repressed emotions, and it offers the possibility for a new pathway in helping our patients with medical illnesses. Thank you.